I think mantle cell lymphoma has been one of the success stories of treatment in lymphoma through my career. When I started as a trainee, the median survival with the disease was about 3 years, and what we see now with primary treatments, if they include autologous stem cell transplant, progression-free survival for first treatment is now in the range of 9 or 10 years. So really the goal of the review was to try and focus on where the big questions remain. And so in the primary treatment setting around transplantation, some of the questions range from do we need to do transplants now that we actually have much more active regimens. So again, similar to the myeloma setting, potentially very deep MRD negative states, you could randomize, as is being done by the US Intergroup now, to ask if the transplant's necessary. At the same time, can we further build on taking advantage of the novel agents that were used in the relapse refractory setting, BTK inhibitors, BCL2 inhibition, and try to move them earlier into the disease course and combine them with frontline chemotherapy or potentially replace it? So we really focused on those themes. And then, lastly, even in the high-risk patients, so patients that have P53 mutations, are there better strategies than what we have currently available, and then how do we stream those patients towards novel, innovative programs that, again, will lead to patient benefit?